Well, hello and welcome to another fun-filled, fact-stuffed Thursday Live here at the Association of PEMF Professionals. I'm Dr. Jerry Dreessen, the AOPP Executive Director here at this wonderful organization that's all about how we can help you and how we can help you learn more about PEMF, how to use it in your business, if you're doctors, how to use it in your practice, best uses and things that we find out that we want to pass along, and also things that we learn from you and we want to learn about stuff as well. So we get to start out with a big howdy from Texas. Thanks, Deborah. Glad you're on today. And we're trying a couple of new tech things out here. So forgive me if I'm bouncing around, but hopefully we can have a little bit better production than this old clunky 2025 problem that we're having. So with that, let's just jump right in, and I'm going to start out by getting smaller while the presentation gets bigger. And today we're going to be working on some information that we got on people's responding to us, asking us questions, and what pulsed electromagnetic field therapy does in the body. And then also some safe language for humans and animals. So, again, as you know, more and more people are buying, using, building businesses with PEMF. They're getting amazing results with it. Those of you that are in this field know how exceptionally awesome it is. I see it all the time in my practice, and I always get the people that stand up and they go, I don't know if I'm imagining this, but, and then they'll tell me how much better they feel. And it's like, no, you're not imagining it. And what's nice is what you're feeling is a change. It's not an analgesic. So it hasn't made you numb. It's made the areas that are causing pain no longer causing pain. So, and it's a drugless process. So that's why I jumped on board probably 15 years ago, I think. So as one of the usher-inners of PEMF, I was in the state of Washington, and I was like the first chiropractor to even have a PEMF machine when they first came out. So it's great to see the organization grow to where it is now. And so let's just jump in to today's live. And if you've ever asked or been asked, what is PEMF actually doing? You're not alone. And this is one of the most common questions from new clients and the PEMF curious. And I see it in my clinic. I have a little poster that they can read about. And the idea is to be able to help people learn about this without getting over technical. And if somebody's had biology and they know the Krebs cycle and they know mitochondria, that's a great conversation to be able to have with that person. But if they don't even know, body sciences, and they've never gone through any of that in school, then you have to learn what the person knows, so that way you can make that connection and that they can learn without putting them to sleep with your amazing technical knowledge. So let's just jump right into it. And a lot of the internet messaging jumps straight to big promises. And so today what we want to do is the opposite. We're going to start with what PEMF is, what it plausibly influences, and again, language people, and what people commonly notice, and what we can responsibly say without drifting into medical claims. And until we have a double-blind peer review study and it's being sung at the top of the rafters where everybody can see it, we can't quote ourselves, even though we know that this is some pretty strong therapy going on. And so the goal isn't to sound complicated. The goal is to sound credible. And credible means clear language, realistic expectations, and then measurable outcomes. And if you're a practitioner, again, this will help you communicate with human and animal owners in a way that protects your scope, protects the client, and protects the reputation of PEMF. And If you're new to this, it'll also help you evaluate what you're seeing online and then know what to expect from doing a session. So how PEMF works without the hype. Again, this is what we consider safe, credible language for humans and animals. And then, what is PEMF actually doing? That's the number one question. And the online claims, they can sometimes jump to promises. And again, like I said, this talk doesn't. So the goal is clear language, realistic expectations, and measurable outcomes. So for practitioners, this will help you protect the scope and credibility. And for clients, you can know what to expect and what not to. So PEMF, what it is, it's pulsed electromagnetic field. That's what it stands for. And it's delivered via coils, mats, pads, or applicators that are near the body. I like to tell people that it doesn't even have to touch the body. I'll split off and say it's not an electromagnetic, it's not physical therapy where you have to have a goop and gel with a device touching it or having a sticky pad that adheres to the body. Those are electrical modalities. That's ultrasound, that's TENS unit and or stim, electric stim. That's not what this is. And that's when I tell them, I said, in fact, it doesn't have to touch your body. It can be used over clothing, which is a totally different system. And then once they understand that basic part, I'll have patients come into my clinic. They go, "Oh yeah, I've had TENS units before." It's like, this is not TENS. And then when they understand what it is, then they are like totally on board with it because of how good it feels. But then also, you want to educate the people that are using it, so when they go out and they tell somebody, that they have an idea of what it is too, without feeling, it's like, man, I don't know what it is. It's this thing that clicks in my body and gives me this electrical shock and it makes me feel good. That's kind of the classic what a person says it does that isn't given the right words to say. Sorry, let me go back. So again, it's used calmly with animals that are either standing or resting. Devices and protocols vary. So there's results vary. And it is an external stimulus, just like light, heat, movement, infrared, for those that are into that process too. And again, it's not a drug and it's not magic. And it's an input. So your body decides how to respond, which is true. In this, on way down at the cellular mechanism, if there is inflammation going on, if it's over a muscle, if it's over a joint, your body's going to respond to it differently with that input. And then how we talk about PEMF responsibly, again, the physical level is pulsed field is present. Cell tissue level is it's studied for signaling and regulation effects. The whole human level, comfort, movement, recovery, sleep, those are all processes that are there. And then the credibility is lost when people jump from number 2 to cures. So unless you can absolutely prove it 100% of the time, using the word cures is something we cannot use. It allows the body to begin to heal itself, is a phrase that I like to use, or the animal. It allows the tissue to begin the process that is used for getting better processes, better blood flow. So, those are the things that we like to use. And so we translate mechanisms into wellness outcomes. And then also that way the claims, they can stay anchored to observable trends. So what we see in the field or what we're seeing online, or I wouldn't say just online, because you'd have to say, what we see on AOPP's site or the companies that make the devices versus, what I see on YouTube is, and then that could be anybody's, that could be a neighbor talking about it. So again, as you know, beware of what you say to people because they will hold you accountable to it. So the responsible explanation is that it provides a time varying electromagnetic stimulus. And it's a nano pulse if you really want to get down into the geeky side of it. So people go, well, what about EMF pulses? It's like, well, this is not an EMF. It's not a constant on all the time, and it's a different frequency than like the power lines give off. That was the original debate. It's like, well, isn't this the same as just standing under a power line, and aren't those harmful and cause cancer? And no, this is dialed into Earth's natural magnetic field, and it's a nanopulse, so it's a split, a micro split second of a delivery, and then it's back off. So that's what again makes this so special. Changing fields can induce very small electrical effects in tissue, and the body already uses bioelectric signaling, and PEMF is studied as a supportive signal, not a controller. So again, it helps the body do what it was already intended to do. It helps the cells do what they were already intended to do. It provides the deep microscopic levels to continue to do what they need to do with more power. It's like throwing batteries into mitochondria, I guess would be a way of saying it. And it's studied as as far as different signals and different responses. And so some devices have different frequencies that you set it at based on what area of the body you're working on, whether it's tissue or an organ or extremity. Some of them are set at Earth's magnetic field, and then it's just a matter of how much power and time you put into it. So it depends on your devices, and the people that make your product, they know that, and they tell you that. So the signal or the client language is it's a gentle signal, and the body responds if it's ready. And I'll have two different people, same settings, and one of them feels it more and the other one barely feels it. And oftentimes it's because of what's going on intracellularly in their body. If they have an injury, what their water content is, and then like I'll put it on an area of their body and they feel it somewhere else. And we often say, well, it goes right to where it's needed. Well, actually, that's a very sensitive part of the body, and it's going to sense the magnetic field more in an area where there's like a microinflammation going on. So some people go, yeah, you put it on, it goes right to where you need it because you feel it. And it's like, well, actually, it's going everywhere, but you feel it there because that's an area that's more sensitized because it's inflamed. So what PEMF does at the basic level. And so it is things that people and animals often notice is that it's relaxation during or after sessions. I have people that fall asleep. Sense of ease, warmth, or loosening, better sleep quality or settling, and improved next day recovery or movement willingness. I'll be the first to tell you, if I'm out chopping wood or helping a buddy move, I'll put it on my low back and I'll use it for 20 to 30 minutes on low. And right afterwards, my low back is all loose. The next day it is not a feeling that I would think that I would have after doing a day of lifting, bending, twisting. My low back feels almost like I didn't do anything. And that's always been a really cool thing about PEMF. And again, the key rule is to describe the experience and function, not the physiology. That's kind of where I fault a lot when I'm talking to people. If I see them nodding off, then I know I've gone too far into the technical side. And so basic language is always the best thing to start with. And then if the person having it done or the observer having the animal done, if they begin to ask more questions, then you can start to answer them. But if you bombard somebody with technical stuff, they're like, I'm not sure I want to ask any more questions. So examples to track, again, describe the experience and function, not the physiology. So for humans, it's movement, ease, recovery time, and sleep quality. In animals, it's willingness, transition, and demeanor. So those are things that they can track, that they can begin to see the changes in, or what to expect. Like, well, if I use this, what do I expect? And it's like, well, you should have better movement. Um, your injury that you have, you should be able to recover faster, and you should be able to sleep better. So where PEMF fits best, again, recovery is multifunctional or multifactorial. So sleep, stress, movement, workload, that all changes. PEMF supports routines. It doesn't replace them. So we use it before the activity, after the activity, and between sessions. And this is great for, I've gone to powerlifting competitions, and I'll grab a group of people like, hey, I'd like to have you try this before your event and then right after your event, and then tell me how you feel. And I'll have a line. Once 2 or 3 use it, they'll tell their friends, and all of a sudden I've got 10 people wanting to try this out. And I'll say, well, who is up next in their event? And so we'll kind of sort it that way. That way they can get a chance to use it. And then it's even like 5 minutes. Put them on for 5 minutes on their low back or their quads or their shoulders, or whatever body part they're using for the next event that they're in. And then afterwards, we'll hit them again, and they'll do the double take, and they'll say, "I'm sorry, what is this again?" And that's a great conversation to have. So. Again, the nervous system settling is a major benefit, especially in the animals. So again, remember, more intensity does not mean better results. It's a saturation. So a micro level is going to saturate the area. It's going to blanket the area better than a high impact, which is going to be just kind of local to that spot. And you'll have the client or the patient say, "Hey, doc, can I crank this up even more? I want the jumping. I like it when my whole body jumps." And that's not often what they need, because sometimes that large spasm can interrupt the healing of the tissue. So it's better to go in low. We call it low and slow, just low intensity, slow time, and have it blanket more of the area so that more tissue can go through the healing phases. And setting realistic expectations. So again, subtle changes first, variable sessions to sessions, or it varies from session to session, and then trending over 2 to 4 weeks with consistency. So in my clinic, I have people that have injuries, and then they use this, and they're coming in twice a week, 3 times a week, and then their initial symptoms, their complaints disappear. They're able to do more. Their function improves. Their issues that they had decrease. So again, sometimes they'll come back and they're more sore. It was because they did more. It's like, well, I felt really good, so I just did more of what I normally do. But they begin to understand it. And again, that's kind of the cool part about PEMF, is people that use it and understand it, now they know, and they come in and they go, yeah, I was out, helping a buddy move, or I was lifting weights last night. I just wanted to come in and use PEMF on my back so I can sleep better. So they'll start to understand and get it, and they'll come in and use it for it, which is nice. So some things to know is that one session is not going to fix it. It's definitely going to change how it feels. But again, it's not guaranteed or to have same results. So I came in last time with back pain. This really helped me out. There's millions of fibers in your low back, and it might have been this session, or this area over here, which has a lot of blood flow. Now you've injured this area over here, which is a different set of vessels, different set of tissues. It might be more, white fiber versus red fiber. And so they'll say, well, how come it worked so well last time I used it? And in their mind, it's put it on my low back. And in your world, in chiropractic world, was it over the SI joint? Was it over the lumbar? Was it down in the glutes? Was it, over in the TFL? In their world, it's just one spot. So that's kind of the differentiation you need to be making. The same with animals. Was it in the exact spot for the same amount of time? And is that animal experiencing the same exact symptoms, or is it a different area close to where you were using it? So those are some things to have to talk with people that you're using it. And as far as don't expect PEMF to replace sleep or replace current rehabilitations or to replace what's going on medically or vet care. So this does the PEMF. I'm grabbing the double ring. You just can't see it. PEMF does not replace their current medical care that they're getting. It is in addition to, and it works with. So that's I always say it's ancillary to what's going on. So then what builds the trust and also what protects the scope? Well, again, it supports comfort and mobility. It supports recovery routines. It supports relaxation and sleep quality. It's client reported changes and observed trends over time. So those are things that you use to track. Mrs. Johnson would come in and go, I haven't seen any change at all with this thing. And well, wait a minute, let's check your range of motion again. And remember when you bent your arm, I measured it, and you're only able to go, 20 degrees, and now you're going 45 degrees. Oh yeah, I totally forgot about that. I guess it is working. And again, people don't track in their brain the stuff that we track, and so oftentimes in their world, it's like it still doesn't go where I want it to, but where you started and where you are now, there's a 20% improvement. And so things that are observed over time. But if they go into it knowing that, like we talked about, this isn't going to be a one-time fix, you're going to definitely have changes. And if you're getting positive changes, then the more we can use it on these areas, the more of those changes you should be getting, not you will get. Because we can't make up for what they do after they leave you. So if they go back out and they're, shoveling snow, or they're, baling hay, or they're, riding goats, who knows what they're doing afterwards. And so that's the important part too. So avoid words like it treats, it cures, it heals, it fixes. Again, it eliminates disease or, wipes out inflammation. If you have in your head that PEMF helps the body do what it wants to do. So if the person's body isn't getting rid of inflammation, what are the other things going on in their body? Are they allergic to something? What else is inhibiting the body's ability to reduce that inflammation? So what you don't want them is saying, well, you told me to get rid of my pain. You told me my inflammation would be gone. No, I told you that PEMF is a device that helps your body get rid of it. So if it's not gone, there's something else going on in your body that's not allowing all of this to help you. So that's what we need to figure out, is why is that happening? And then of course, works for everyone. In my clinic, I'll say, hey, I want you to try something, and then I'll have them try it for like 5 minutes on an area that's bothering them. And I would say there is about 10%, they'll stand up, they go, I didn't feel anything. And in where I am, it's like, okay, well, we tried it, versus like, whoa, this is really helping out. What can we do? And then we get them on a program. So they get a chance to try it. If you're out traveling and you're going someplace, you want to be able to provide a noticeable change with what you're doing. And if you made an appointment for somebody and they came in and it didn't help them, then you both feel bad. So I guess for you, as far as building your business, is there a way for somebody to try it and determine whether or not it helps them out? And oftentimes those are the people that are sitting off to the side where you're working on somebody, and they go, well, that helped my shoulder. Hey, you know what? When we're done here, let's try about 5 minutes on your shoulder. Let's see if you notice a change, because it doesn't work. It doesn't happen for everybody. It might even be how thick their clothing is. They might be on their jacket, or or they've got thick leather skin. Those are some things that can be going on too. So again, also, never ever say, hey, this will, if you want to get rid of your doctor, I guess people that sold apples, did they have that problem? An apple a day keeps the doctor away. Can you, is that a claim? Again, you don't want to say PEMF a day keeps the doctor away. And then as we're wrapping up here, let's see here. So again, PEMF is used as a supportive wellness tool. We define a goal, we track a few markers, and then adjust based on the response. And again, we focus on comfort, recovery, and settling while tracking behavior and movement. And we partner with your vet when needed. We partner with your doctor when needed, your DC, your DO, your naturopath, your massage therapist, your acupuncturist. And then credibility comes first. So know when to pause and refer. If there's sudden pain, if there's neurological symptoms, if there's a fever, if there's acute lameness or swelling or behavioral changes in animals, then again, just use the clean language and tracking. And sometimes people won't tell you that they're on medication, and they go, wow, my mouth is really dry, or I'm feeling a little lightheaded. And you're looking, you sure you're not on any medications? Oh yeah, I'm on gabapentin, but I forgot to tell you, or I didn't think it was that big a deal. And so, those are some things that you need to know ahead of time, and they need to know ahead of time that if we're on medications, again, PEMF may cause that medication to work better, to be more efficient. So know what the toxic changes are for a medication, and they might even always have them drink water before and after, and all of those things that we teach in our certification programs. So again, our future depends on your professionalism. So if you can up your game when the boards, the veterinary boards, when the medical boards, when they convene and they talk about PEMF, they'll have nothing but good reports on it because of how well you've done your homework and how you are, working. And again, we at the AOPP are out there battling it for you as well. So, just having our certification programs already in place and been going on for years really helps with that too. So the call to action is to follow AOPP for research informed education, ethical standards, and outcomes focused practice. We have on our website places where you can go to learn things, and then if you want, you can jump in and get your certification. Again, we do it with humans, small animals, large animals, infrared, and then just like a general, like what is PEMF, kind of like what we're talking about now, but goes a little bit more in depth. So thanks again for your time. We've been talking about what pulsed electromagnetic field therapy does in the body and how you can help this amazing institution grow in a very knowledgeable based system using the proper language so that we're not throwing out claims that we can't back up or saying things that somebody's going to grab and say, well, you posted this, or you said this, or hey, these people are over here using this machine and they're claiming I don't need to see my doctor. That's the stuff that won't happen with you guys because you're here watching this stuff, but there could be somebody else that's using it, or they borrowing the machine and they don't know what it's all about. So that's what we're trying to prevent. So again, thank you very much for your time today. And if you have any questions or tips on PEMF, shoot us an email. We've got info@PEMF.com. Hold on. Joanne said hi, and I want to jump in there. There we go. Hi, Joanne. Thanks for saying hi. And if you're interested in becoming a member, we are in a whole bunch of countries, and we've got lots of members. So we are growing, and thanks to you and sharing. So becoming a member today, PEMFprofessionals.com is how you do it. And then at that point, just going through the sessions and learning what we're all about and getting your certification. Whether you are just doing it on your own and you have some curiosity about it, or you are actually creating a business and you are wanting to know how to work on humans and how to work on animals. And those are the things that the certification process is all about. And again, Patricia, where did you go? Wow, this is really laggy. There we go. There we go. Thanks, Patricia. All right. And then with this, again, thank you so much. No, like, and share. Click the like button. I see we got a bunch of thumbs ups and hearts over here. So thank you so much for those of you that are jumping on live. If you're watching the recording, thanks for watching. And grab our blog and share. If you're on Facebook, you can share it with people. And we've got lots of great information that's out there. Liz, thank you. Glad you like it. And that's our goal, is to send out all the information on these live streams to help you out as well, because we love you and we love PEMF, right? So with that, I will end today's live, and I'll see you again next week. So take care and have a great rest of your day. And dare I say it, go Hawks.